So have you heard about PRP and wondering what makes it work? Happy to fill you in on what PRP is. So PRP stands for Platelet-Rich Plasma. And really what makes PRP work are the platelets. There's lots of PRP systems out there, and PRP is used for a variety of things. It's becoming more and more popular. It's been around since the 1940s. That's when the original research started going into what PRP is. But over the last 10 to 20 years, it's become even better in its ability to localize and find those growth factors that are really important for healing. The science has gotten better behind it. So again, not all PRP systems are the same. There's, just like cars are different. You have really nice cars, you have cars that don't work so well. It's kind of the same when it comes to PRP. I like to use some of the systems that are the better ones, because that's what I want in me, so that's what I would use with you. And really what comes to what makes PRP, what separates, how do you tell, okay, what makes good PRP versus not good PRP, we'll call it, is really the cell count of the platelets. And so a lot of research has shown that if, we get below 3.5 billion platelets, we're really not seeing much improvement in getting healing. So the better PRP systems will get anywhere from 7 to 10 times that, so 7 to 10 billion platelets. So we're able to, you think about one system that if we're going to put 3 billion platelets in that area that's hurt and injured, yeah, your platelets are going to help your body heal. But if we can put 7, 8, 9 billion platelets, and then on top of that, take your plasma and concentrate your growth factors that the platelets regulate and work in combination to get you to heal, that's what really makes a good PRP system. So one of the differences, again, I'm a surgeon in the foot and ankle. I've done lots of surgery, and I guess in the way that I approach it is I've seen that tendon, I've seen that joint, I've looked at it with my eyes, and so I know where I'm going to direct that needle. Ultrasound is a very important tool that I use. I'm able to kind of visualize in my mind what your tendon looks like, that injured tendon, because I've seen what it looks like when I've been in the OR operating on an injured tendon. And so the benefit of ultrasound is I can see that injury, I can watch the needle go directly into that spot, and I can put the amounts of PRP that I want to each spot of that injured tendon to stimulate that body's healing response to get you better. Also, the name of the clinic is Restorative Edge Clinic. So we're trying to restore you back to where you were, but also the goal is to keep you better. And so if all we ever do is just help your pain get better, but don't correct any of those processes that led up to that potentially, then we're just kind of walking in circles and not making any progress. One of the other things I like to use is something called shockwave therapy. Shockwave therapy is a ultrasonic sound wave that we can direct at different depths within the body tissues, and it also stimulates a healing response. It stimulates blood flow. Blood is super important in the body as far as how we heal. Again, it carries our platelets, our plasma, and then oftentimes in an injured area, that blood flow is diminished, and so that's why that injury remains and it just keeps happening. And so shockwave therapy is a good way to augment what PRP is doing by stimulating that blood flow, by mobilizing those cells to get them working better. So that technique of shockwave therapy and PRP is important. Also, a full evaluation of what's going on with how your body's working, as far as how you're walking, how you're standing, what the mechanics are of whatever joint we're looking at. That's important to help in determining how we're going to get you better and keep you better. There's a lot of great technologies, the nutraceuticals, we like to call them, the nutrients that are pharmaceutical grade quality, are also something we like to employ to help your body heal and really augment its ability to heal and get you back on your feet quicker. So again, at Restorative Edge Clinic, we use the best of the best when it comes to the PRP and those delivery systems. We use the best of the best when it comes to shockwave therapy and the techniques we use there. And then the goal is, again, the one-on-one care and truly trying to get you better, and so that you can get back to life and not spend time at a doctor's office. So if you found this video valuable, hit like and subscribe and drop a comment below. And if you're in Arizona, I'd like to be your go-to resource for non-surgical options to get your pain better. I'm Dr. Keith Bangart at Restorative Edge Clinic.